Thank you for taking the time to watch the Healthy Child story, which is the story of how 15 European research partners have worked together with the aim of improving outcomes by personalizing diagnosis and therapy in pediatrics. Following the Healthy Child story, we will be going through some of the highlights of the work done. And I hope that what we will present will be a summary clear and understandable enough for an audience of experts and laypersons alike. Let's first try to give a quick definition of what is Healthy Child. After this definition, we shall let the people directly involved in making it happen tell their own story. As we shall see, Healthy Child has achieved some significant outcomes during its 4 years of work, which started in 2006 and ended in April 2010, thanks to 12 million euros of funding through the European Commission's ICT for Health funding mechanism of its Framework Programme 6. During this period, there have been 3 public events in which Healthy Child results have been shown. Genova, Festival of Science in September 2007, Rome, the 140th anniversary of the Ospedale Pediatrico Bambino Gesù in September 2009, and in Sestri Levante in April 2010, the final conference of Healthy Child. What you will see will be partly interviews and clips taken from these events. What is the importance of tackling pediatric issues? Infant and childhood diseases are a large and underappreciated public health problem because these patients have long lives ahead. The burden and cost are substantial for families and society. As we shall see, Healthy Child brings a new light for the pediatric disease management. What was Healthy Child's focus? Healthy Child project started in January 2006 with the aim of developing a healthcare platform for European pediatrics, integrating traditional and emerging sources of biomedical information from cell to tissue, organ, individual, and population. The focus of the project has been on congenital heart disease, arthritis, and brain tumors in children. It has addressed the critical need to integrate, exploit, and disseminate the knowledge of leading pediatric centers through advanced IT tools that allow the searching and matching of complex clinical cases. Healthy Child goes beyond the traditional dependence on single-level or single-modality data and derives its analytical power by vertically integrated biomedical information from an unprecedented variety of sources. This new paradigm applies to all 3 pediatric domains addressed: cardiology, rheumatology, and neuro-oncology. It opens up an entirely new and broad support for medical practice and research, especially with respect to children. The project underlined and demonstrated the importance of large heterogeneous repositories of clinical relevant data. Intervention and surgery planning benefit greatly from the access to and matching against previous cases, as in the case, for instance, of pulmonary valve implantation in patients suffering from the blue baby syndrome. Tetralogy of Fallot is the most common cause of blue baby syndrome, a serious congenital heart disease requiring corrective surgery in infancy. As the patient grows into its late teens and early adulthood, it is common to have severe pulmonary regurgitation. Clinicians facing the management of such conditions are confronted with complex treatment decisions, including pulmonary valve procedures in the majority of the cases. The Healthy Child project supports clinical decision-making by improving disease characterization and identifying similar cases in a network of leading hospitals. The personalized model of the anatomy is extracted from advanced imaging to enhance diagnostic accuracy. The patient's heart is compared against a large repository of already treated patients with known outcomes. The morphology and dynamics of pulmonary trunk help to determine whether percutaneous pulmonary valve implantation, a minimally invasive approach, can be attempted, or whether surgical treatment is necessary. In the latter case, a more sophisticated electromechanical model of the patient's heart is used to virtually perform and evaluate the effects of the open heart surgery. Healthy Child has pioneered the development of dynamic models of the fast-moving cardiac valvular apparatus with unprecedented morphological and temporal resolution. Such models, combined with the ones covering the electromechanical physiology of the heart, contribute a better disease understanding and therapy planning by providing a systemic view of the whole heart as a complex and long-lasting pump. Healthy Child also made important steps towards the personalized management of juvenile idiopathic arthritis by proposing the first magnetic resonance imaging protocols for scoring the disease progression, thus opening the potential for personalized treatment. Furthermore, Healthy Child helps the understanding of childhood gliomas, a specific type of brain tumors, by developing a low-cost chip that allows analyzing 136 different mutations relevant for the formation and anamnesis of pediatric brain cancer. Many of these mutations are known to be related to the prognosis of the disease and predicting the response to treatment. Through an expanding, sustainable, and interdisciplinary partnership of leading hospitals and institutions for cutting-edge research and development within and beyond the European research area, Healthy Child has shown the potential to become the world's leading pediatric network for biomedical information retrieval and analysis. Taken together, Healthy Child's developments will directly contribute to the European industry gaining competitive advantages in both medicine and information technology. In fact, the availability of Healthy Child's databases will enable researchers to conduct a new generation of epidemiological studies based on much broader, better integrated and cleaner information. In the future, European or national policies on medical issues may be modified to reflect the results derived from such studies, thereby benefiting the lives of all citizens concerned. The Healthy Child platform has undergone security assessment and has been in operation since 2008. It is currently secure and anonymously hosting the health records of patients enrolled for the project, and clinicians and researchers have been since exploiting its rich functionalities. In 2008, the Healthy Child platform has won the Best Exhibition Prize at Europe's largest information and communication technologies conference, the ICT 208 in Lyon, France. Regardless of location and thanks to a simple USB key, Healthy Child's grid network provides its clinicians with secure access to both patient and research data of all cooperating institutions, allowing them also to make use of a nearly unlimited computing power to integrate. We can say that Healthy Child has 4 broad social impacts. One is the fact that the availability of Healthy Child databases and infrastructure can improve the success rate in resolving difficult medical cases, saving children's lives. Furthermore, such improved medical decision-making can result in lowering medical costs in treatment duration. Finally, Healthy Child makes advanced and information-intensive medical services affordable for smaller medical institutions and individual doctors. This way, new developments in both medical research and information technology become exploitable by all parts of society, fostering personalized medical care, medical education, and medical information dissemination.